Former Trump Homeland Security and Counterterrorism Advisor Tom Bossert was watching what was going on all weekend with coronavirus and warned on Twitter, quote, "We are in trouble." He tweeted out data on the rising number of new cases in some states and emphasized, quote, "Masks are important, but not enough." And former FDA Commissioner Scott Gottlieb, who's been on this show many times, warned that the current spike in coronavirus cases in several cities could be just the start now of a second wave.
We're right back where we were at the peak of the epidemic during the New York outbreak. The difference now is that we really had one epicenter of spread when New York was going through its hardship. Now we really have four major epicenters of spread: Los Angeles, cities in Texas, cities in Florida, and Arizona. The case fatality rate is going down, although we're not able to measure it right now because we're able to save more people who are hospitalized and get critically ill because of advances in care. The number of deaths has gone down because the number of infections went down for a period of time, but the total number of deaths is going to start going up again as the number of hospitalizations starts to spike again. So we're going to see deaths creep up, and I wouldn't be surprised in the next 2 weeks to see deaths go over 1,000.
Well, let's bring in the director of the Harvard Global Health Institute, Dr. Ashish Jha. He's a practicing physician, also professor of medicine at Harvard Medical School. Dr. Jha, great to see you as always. Do you share the concerns we just heard from Dr. Gottlieb and we've heard from many public health officials about these spikes that we're seeing across the Southwest and Southern California, down in the Sun Belt as well, Texas, numbers spiking to record levels day by day? Where are we in this right now, and how concerned are you about where we are?
Yeah, so good morning, Willie, and thanks for having me on. I am very concerned, and I very much share Scott's take on this. Here's the bottom line. We're heading in the wrong direction as a country. We have cases going up, not just in those four hotspots, but when I look across the country, I see lots of other states going in the wrong direction, from Utah and Nevada to smaller states like Idaho. We're just seeing about 2 2/3, maybe 3/4 of the country heading in the wrong direction. The problem is that deaths always lag, right? The people are going to get sick. We're now seeing hospitalizations increase. And I completely agree with Dr. Gottlieb that in the next week or two, we're going to start seeing deaths increase. And what's striking to me is that we always assume the best, or at least what we hear from our political leaders is the rosiest scenario, where we really should be planning for the worst and thinking much more critically about where we are and how we stave this off.
You know, Dr. Jha, just anecdotally and seeing all the coverage this weekend, watching the way people celebrated 4th of July. Look, they've been cooped up for 4 months at this point. They want to get out and have a 4th of July, but there wasn't a lot of social distancing. A lot of fireworks shows were canceled. Some weren't. What concerns did you have watching this 4th of July weekend where we were all outside trying to do our best to social distance, but it was a difficult thing to do on that holiday?
Yeah, and July 4th is obviously a really important, fun holiday for all Americans. Things that made me feel better. So first is, at least in some places, I did see a good amount of mask wearing. Second, I think the evidence is pretty clear that being outdoors is much safer than being indoors. And so that made me feel better. And I'm completely sympathetic to the fact that we've all been feeling cooped up. And I wish we lived in a country where our political leaders had prioritized bringing virus levels down so we could celebrate the 4th of July much more openly and much more the way we've always done it. But we obviously, it was a much more of a restricted weekend because of that.
So the president tweeted about testing over the weekend, writing in part this: cases, cases, cases. If we didn't test so much and so successfully, we would have very few cases. Yes, he's making that argument again. The president also downplayed the severity of the virus.
We've made a lot of progress. Our strategy is moving along well. It goes out in one area and rears back its ugly face in another area. But we've learned a lot. We've learned how to put out the flame. Now we have tested almost 40 million people. By so doing, we show cases, 99% of which are totally harmless.
The commissioner of the FDA was asked about that claim of 99% of the virus cases being harmless yesterday.
I'm not going to get into who's right and who's wrong. What I'm going to say, Dana, is what I've said before, which is that it's a serious problem that we have. We've seen this surge in cases. We must do something to stem the tide.
So you won't say whether 99% of coronavirus cases are, quote, completely harmless is true or false, what the president said at the White House last night.
Dana, what I'll say is that we have data in the White House task force. Those data show us that this is a serious problem. People need to take it seriously.
That's FDA Commissioner Dr. Stephen Hahn. He knows that 99% of the cases, Dr. Jha, are not completely harmless. So let me give you a crack at that. I suspect you won't be so shy about answering it.
Yeah, so look, I'm very sympathetic to the situation Dr. Hahn is in, which is he can't stand up to his own president. And I understand that. That's a difficult situation for anybody. But as a public health person, I wish he would just come out and say what we know, which is that a large proportion of people, certainly 5 to 10% of people, end up getting hospitalized. It's not trivial for them. And many people who are not hospitalized still end up having pretty substantial symptoms, many of which can linger for months. This is not a benign disease. And it isn't helpful to anybody for the president to characterize it as such. And we all know that. And I just wish the president would just level with the American people and be very clear about how serious of a disease this is.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.